It is question day 6. We're talking about bioidentical hormones. Do I need them? Are they safe? What's going on? Why all the confusion? So it's all about bioidentical hormones today. Thanks so much for joining me. And whatever channel you are on, give me a shout out. Let me know who's here. Let me know how your Wednesday is going. I do see Donna. Welcome. So good to see you. So you've been submitting your questions. Hey, Alice. For my One Thing Hormone survey, if you haven't submitted your questions, please follow the link at whatever channel you're on. It should be somewhere on that page or on this post where you can submit your biggest concern or question about your hormones. And also, we're thinking about launching the Hormone Balance Mastermind again this July if we have enough people interested. So let us know. Is this something that could benefit you? How would your life change if you had hormones that were balanced by the time the fall came? So just let us know and let me know what your questions are. So yesterday, we were talking about hormonal migraines and a few other things, and we didn't get to all the questions. And I said we would talk about bioidenticals today. I see Deanna's here, Renew is here. Hi, so good to see you guys. So we're going to dive into talking about bioidentical hormones. So just a little background. I'm trained as a board certified OBGYN, delivered many babies, did pap smears, hysterectomies, the whole thing. And over 10 years ago, my health really faltered. I weighed 243 pounds. I had chronic fatigue, fibromyalgia, so pain in my body every day. My mood was terrible. I was depressed. I was anxious. I really didn't feel comfortable in my own skin. And maybe you can relate to this. Many women at midlife I talk to, once they hit 40, they're like, what happened to me? I don't feel like myself anymore. If that is you, definitely give me a thumbs up and a shout out and let me know. So that was what was going on for me. And here I am. I'm supposed to know more about women's health than anybody else, right? Board certified OBGYN. And yet all the tests I run come back normal. I can't find anything wrong. What's wrong with me? I go to my doctor. She runs tests. Nothing wrong. And I really thought that I was crazy. And I talk to so many women between 40 and 60 and beyond who think that they are crazy too. And I think it's important for you to get this information to know that you are not crazy. Right? When your hormones are off, you don't feel like yourself. The symptoms are widespread in all systems in your body. And there seems like there's no rhyme or reason. And to you, these symptoms are all disparate, and to your doctor, because they're trained to hit symptoms with hammers, which are drugs. And so you can feel very crazy. But once you really understand what hormones are and how they work in your body, and that they are the communicators, and you realize that communication in any system is what makes that system run smoothly or be a dysfunctional system, then you get how you can have gut dysfunction all of a sudden in your 40s or 50s and never had it before. And that's related to your migraines, and that's related to your hair loss, and that's related to no sex drive, and it's related to every symptom in your body. And so I didn't know this when I was just practicing regular OBGYN, because we're not trained in that, right? It's not my fault. We weren't trained in that. And my health suffered for it. And when I discovered a root cause resolution approach to health, I made a pact that day. It was a Saturday, and my kids had gone to the movies with their dad. They came in because they knew that I would be in the bed in my pajamas on a Saturday, because that's the only place I ever was when I wasn't working, because I had no energy. And they said, we're going to the movies. They didn't even bother inviting me anymore, because they knew the answer was always going to be no. And they said, we'll be back. So I picked up the book by Suzanne Summers that my patient had given me, who had transformed over a year. And when I saw her come in the office, I saw her at the end of the hall. I couldn't wait to get her into a room to say, what did you do? Because she was at midlife like I was, and she was suffering with all the same things. She couldn't sleep, weight gain, memory problems, no sex drive, like all the things we get at midlife. And I did my usual MD things and they weren't helping. And that's birth control pills, antidepressants, sleeping pill, right? You guys know this because a lot of you have left your doctor's office with a fistful of prescriptions. And so she went away. She came back. I saw her. It's like, oh my gosh, she had lost all the weight. Her skin and eyes were bright, hair full, mood great, sleeping well, everything transformed. And she said, I learned about this thing called functional medicine from Suzanne Summers' book, which is an old book now. There are way newer books. Everybody's like, what's the book? It's not the book that's your answer. It's getting the root cause resolved of your health problems. So I didn't read the book for the longest time because I said, oh, it's by Chrissy on Three's Company. Like, what is she going to teach me about women's health? I'm board certified OBGYN. So I had something called contempt prior to investigation. Maybe you're familiar with this because maybe you've done this too. You think you know everything about a subject, so you close your mind to any possibilities of anything else being true. Well, that was me. And she talked about bioidentical hormones in there, but I read that whole book that day. You know, at first I realized, oh, it's not anything about Suzanne. It's her using her celebrity to interview these doctors and scientists in this field of root cause resolution medicine. And I knew that what they were saying was the truth when I read it, because I had gone to medical school and I had learned about all the beautiful physiology and biochemistry of how the body works. And they were talking about that. And they were talking about tests I never heard of, salivary cortisol test and sex hormone testing in saliva and dried urine I'd never heard of. But I knew that what they were saying was the truth. So all of a sudden I had this hope, wow, maybe I'm not crazy. Maybe there's something wrong with me that the tools I was given when I got my doctorate and in my residency don't address, right? Maybe the tools I have don't have the capacity to figure out what's wrong with me and to help me heal. So if I use these other tools, maybe I can figure out what's wrong and I can heal it. And she talked about bioidentical hormones in there, which I didn't really understand what that was. I thought all hormones were just hormones are hormones. Like, what's the difference? And that's what I find most women I meet think. Let me know if that's true for you. I see Sabrina's here, Karen, Carrie Ann, Alice, Anya, a bunch of you here. Let me know. And Jamie says, just started HRT for migraine. She's determined to fix the root cause and not just throw meds at it anymore. No one talks about this option. Thank you. You're so welcome, Jamie. Thank you for that comment. So, let me know. That was my opinion. I was like, Alice says, exactly. I was like, what's the difference? They're all hormones. And nothing could be further from the truth. But what I'm going to tell you is that in residency, that is what we're taught as OBGYNs, family doctors, internal med doctors. We are taught that sex hormones are just all the same. In fact, so much so that if you look in some of our textbooks, this is gonna kill you. If you look in some of our textbooks, so let me just step back for a second. So there are three main types of sex hormones in humans, men and women. So estrogens, plural, progesterone, and androgens, male, right? So there are androgens are the male hormones. The main one is testosterone, but there's androstenedione and a whole bunch of other, what we call androgenizing male hormones. But the main one we talk about is testosterone. And then the feminizing hormone, estrogen, that's what makes a female, and testosterone makes a male in utero. There are three types of estrogen. So there's estrone with a 1 on the end, estradiol with D-I-O-L for di meaning 2, estradiol, estriol, T-R-I-O-L, which is 3. Those are the three types of estrogen. And then there's progesterone. So most of my colleagues are so confused about what is progesterone and what is not, that in our textbooks and our medical literature, you will actually see them call things that are not progesterone. So what do I mean by this? Because you're going, yeah, so whatever. Okay, I'm going to explain why this is important. So progesterone is what your body naturally has. You need progesterone to balance your estrogen. They're like the yin and the yang. Okay. You've got to have both as a woman to have them balanced. And if you don't, that's when you get dysfunction. You know, if estrogen and progesterone don't meet each other equally and they're unbalanced, this causes symptoms globally all over the body: mood, memory, skin, hair, nails, digestive system, immune function, right? Everywhere is affected. So progesterone is what your body naturally makes, okay? Natural hormone. Now, pharmaceutical companies can't take a naturally occurring substance from the body and get a patent on it, right? Meaning that only they can make it and sell it. So they can't make progesterone and then bottle it up and get a patent and sell it to you as a drug, right? Can't do that. It's a naturally occurring substance. So when the need arose for needing progesterone for a pharmaceutical company to be able to dispense it, and I'll tell you how that happened, which is another interesting story. They knew they couldn't just do progesterone. So what they did is they took it in the lab and they modified it chemically so that it was similar to progesterone, but it wasn't exactly the same as progesterone. And they called it a progestin. So it's not progesterone, it's progesterone-like, and they gave it the name progestin. And there are different types, but the main one was medroxyprogesterone acetate. I know that sounds like a big word. Just call it MPA. So medroxyprogesterone acetate. So they took progesterone, chemically altered it by adding chemical groups, and they made MPA. In our textbooks and in our scientific literature, like our journals, you will actually see my colleagues call progestin or MPA progesterone in the research. So what that says to you is that they don't even understand that they're not talking about the same thing. So this is why I said in the description that apples and oranges are not the same thing. They're both fruits, but they're not the same. I think you'd agree with me, right? Let me know. Give me a thumbs up. Give me a heart. Like, you know, apples and oranges aren't the same thing. Like if you say, honey, get some apples when you go to the grocery store, and your honey comes home with oranges, you're going to go like, I wanted apples. And they'll say, oh, well, they're both fruits, right? You'd be like, are they a little touched? But yet my colleagues, this is what they do in our journals and textbooks. They say, use progesterone and MPA interchangeably. So this is why there's so much confusion among the public, because if there's confusion among the experts, they can't even figure it out. Trust me, it's going to be confusing to you. And that's what you're dealing with, why there's so much confusion. Everyone's like, oh, all hormones are bad. Well, no, that's not true. So where did this come from that hormones are bad? Because when I went through residency in the 1990s, it was like all women need estrogen. It was documented to prevent cardiovascular disease, osteoporosis, and have health benefits. And then when did this all stop? I remember the day that the phone rang off the hook in my office. I think it was 2004. Because the Women's Health Initiative study, which was this huge study, I think initially they enrolled like 160,000 women. They ended up, a lot of women had to be removed, and they stopped the main arm abruptly in 2004 because they found there was an increased risk of breast cancer. So all women stopped their hormones. Everyone freaked out. Everyone called the office. I remember the phone ringing off the hook. What do I do now? Does anyone remember this? If you were back at that age, this is, like I said, around 2004. Let me know. Give me a shout out. And then there was all this panic about, oh, hormones are bad. But wait a minute. Let's rewind. What did I just say? My colleagues get confused about progestin, progesterone. What's another thing they get confused about? They call horse estrogen human estrogen. So the main estrogen that used to be given to women back then was equilin, which comes from pregnant horses. They collect their urine and from pregnant horses, and then they strain out their estrogen and they give it to women in a pill called Premarin. They used to call this estrogen, right? So, but they're saying it's like the same, it's your estrogen, you need estrogen, but it's horse estrogen. It's not human estrogen. It's not estradiol, it's not estriol, it's not estrone. It's equilin. In our studies and textbooks, you will see them used interchangeably. Now, we don't have receptors for horse estrogen in our body, and we don't have receptors for chemically altered progesterone. So this is part of the problem, is that we also have this assumption that the way God made us with our receptors, that, oh, well, it's similar enough, you can put anything in there. Now, let me ask you, when you want apples and you ask your sweetheart to get you apples at the supermarket and they bring oranges home and you say, but honey, I wanted apples, and they go, well, it's fruit. Can't you just eat the orange and be happy with the orange? What are you thinking? You're thinking, no, I wanted apples. Oranges can't satisfy my need for an apple. Can it? Can that satisfy you, right? No, because that's not how we're made. It's not how our biology works. And same thing is with our receptors. If we have a receptor for progesterone and a progestin comes and sits on it, it's like sitting your butt cheek half off a chair. Now that may sound silly, but that's literally what it's like. Are you going to be comfortable? No. Is the chair going to be happy because you have one butt cheek on the chair? No. So you have to have that lock and key, right? You got to have it in that it fits together. So this is where my colleagues are like, oh, estrogen, equilin, same thing. Oh, medroxyprogesterone, acetate progesterone, same thing. They are not the same. So the Women's Health Initiative study, you got to understand what they were looking at that made them see this increased risk of breast cancer that got all women everywhere freaked out. They were looking at equilin and medroxyprogesterone acetate, which we've already said are oranges. That caused the increased risk of breast cancer. So all women everywhere stopped their hormones. Everyone was miserable because you need your hormones to have that, oh, I feel good in my skin feeling, I sleep good, I look good, I feel good, right? And that wasn't happening anymore. So the problem is that there became this myth of hormones are not good for you. But let's dissect that. Which hormones did we just say aren't good for you? Horse estrogen and chemically adulterated progestin. Those aren't good for you. They cause a problem. Nobody said that the natural hormones that God gave you that you were born with aren't good for you. If they weren't good for you, then little babies with coursing estrogen running through their blood vessels to make them a female, right? Lots of estrogen. And by the time we hit puberty and then we hit our 20s, those are the women when we have our highest estrogen and progesterone levels. If those weren't good for you, don't you think that women in their 20s would get breast cancer? And they typically do not, right? It's not until our estrogen and progesterone get unbalanced, we talked about the balance, in our 40s and 50s that we get breast cancer. It is not biologically identical hormones that cause breast cancer. It is chemically altered, artificial, abnormal hormones that sit on the receptor with, like you sitting on the chair with one butt cheek on the chair and one off, that irritate those receptors in a way that increases your risk for breast cancer, strokes, heart disease, all the things, right? So this is why I say you can't compare apples and oranges. And people don't always pay attention long enough to hear this information, to hear what I'm saying. And I say I got Q5 and Q7. We're on Q7 today. Q5 was 2 days ago. And you can't compare apples and oranges, right? They're two different things, synthetic hormones and natural hormones. Okay, so hopefully you get that. And so when I read Suzanne's book, I got this understanding that I hadn't had before in my career, because I was taught as a resident and in all my journals and textbooks, estrogen's estrogen. Estrogen doesn't matter if it comes from a horse, doesn't matter if the progestin was made in a lab and chemically altered, it's all the same thing. So I was taught misinformation, and so was your doctor, unfortunately. It's not their fault. They're bright, they're well-meaning. It's just how we're taught. Because pharmaceutical companies have a lot to say about what we do in our clinical practices. And like we've already talked about, they can't get a patent on a naturally occurring substances. So they're going to chemically alter them or get them from a horse. And then they're going to say, we got a patent. We can spend the money to do the clinical trials, and we can spend the money to advertise it and do all these things to bring it to market. Now, bioidentical hormones on the other side are what you're naturally born with, that you have programmed obsolescence. So you start losing them around the age of 35 and 40, and then your hormones get unbalanced. And then you start having maybe crazy, irregular, heavy, painful periods, endometriosis, fibroids, infertility. That's when breast cancer starts increasing, when your estrogen goes up and your progesterone goes down, and they're mismatched, and you don't have that happy symbiotic balance. And when you start going like this, because that's how you're programmed, because you only have so many eggs, it's your eggs that make these hormones. And as they get a little older and more brittle, they make more estrogen and not enough progesterone. So you get this mismatch, heavy, crazy, irregular, painful periods, fibroids, endometriosis, breast cancer in your 40s. But also weight gain, fatigue, gut dysfunction, irritable bowel, autoimmune disease, decreased immune system function, hair, skin, nail problems, hair loss, mood problems, anxiety, depression, right? Like all the things you're experiencing, this is part of the problem, because these guys are a big part of what keeps you healthy. And so then you go to your doctor and you're like, what happened to me? I feel awful. And what do? Oh, you need a birth control pill. What is a birth control pill, y'all? It's synthetic hormones that are really just a little different than horse estrogen. They're not horse estrogen, but they're chemically altered estrogens and progesterone. So they're progestins and estrogens that are not anything like what your body naturally makes. More synthetic. This is why they increase your risk of breast cancer. Okay. And if you didn't know that, you need to know that. The longer you're on them and the younger you start them, the more your risk of breast cancer with birth control pills. But most doctors don't mention this when they prescribe them to you, but really they should. Why? Because they're like hormones sitting on the chair with one butt cheek on the chair and one butt cheek off. So they stimulate and they irritate, stimulate and irritate, stimulate and irritate. So when you're talking about, at midlife, I'm having all these symptoms of this discrepancy. Well, what do you need to do is you need to bring them back in balance. But it's really impossible once you don't have enough eggs to make these high level of these hormones naturally, to do it without supplementing with bioidentical, which stands for biologically identical. I see Kelly is here, and I see Angelique. Hey, Angelique, welcome. Alice is Premarin. Hey, Lily, Michaela. Hi, how are you guys? Glad to see you. Maribel says, is the hormonal imbalance also creating a thyroid hormone imbalance? That's a great question, Maribel. Let me see if we can work that in. So the sex hormone imbalance doesn't cause a thyroid imbalance, but hey, Tamika, but talking about thyroid would be a great question. If you did not submit your one thing hormone questions, please go to the link on whatever channel you're watching this and submit your question, because I'll be answering them like going into next week. But that's a great question, Maribel, about the thyroid. So now I lost my place. Okay, so it's impossible to fix this gap. Like your body, your eggs are getting old and they're not making the hormones they're supposed to. And you get this discrepancy, which makes you feel horrible. I've been there. And if you're there, you know what I'm talking about. You wake up every morning like, what is going on? And it's impossible to bridge that gap after a certain point with natural treatments. Like, you can eat to help your hormones balance. You can take some herbs to help. And before a certain age, you might be able to bridge that gap somewhat. But past a certain age, and everybody's different, but somewhere between 40 and usually 50 something, you're going to get to this point. You cannot bridge that gap without supplementing with natural hormones. It's just a fact of life, right? We're made that way. We can get mad about the fact that we're made that way, but then that's not going to get us better. Or we can get smarter and we can get our hormone levels checked. We can do the Dutch test, which we talked about in great detail the other day. So check out the other live events. And then you can supplement with naturally occurring, so biologically identical hormones. That means the same that your body naturally has, biologically identical, or we call them bioidentical for short. I'm not talking about synthetic. I'm not talking about horse estrogen. I'm not talking about lab-made MPA. I'm not talking about birth control pills. Those are all synthetic and toxic. Those are the toxic ones. I'm talking about what you're naturally given at birth. That's what you need to bring that into balance. And then, oh my gosh, like the ladies who went through the hormone balance mastermind back when we launched it, I guess it was in January, talking to them yesterday, we had Ashley said, I always like to hear people's wins. And she shared last night during our live Q&A, she is sleeping through the night for the first time since she can remember. And she says, I wake up and I'm like, oh my gosh, did I sleep the whole night? Like, how awesome is that? And so much is important that revolves around sleep. So she's got that. We had Carrie sharing that she hadn't been able to lose even 5 pounds in the past 10 years, and she's now lost 15. Deb M got to her goal weight. She looks amazing. She did this little video of her showing herself in her bathing suit because she is going to the beach this summer. So whether it's weight loss or sleeping through the night or sex drive or hair, skin, nails, autoimmune disease, immune function, dysfunction, whatever it is you're wanting to improve, it all starts with hormones because they're the communicators. So also let us know on the One Thing Hormone Survey if you could benefit from the Hormone Balance Mastermind. We're thinking about running it again in July if we have enough people interested. So definitely go there and let us know. So let me just mention about thyroid that Maribel asked about. So your thyroid is another gland here, and it's about the 7 main metabolic drivers that I always talk about. Maybe tomorrow we can talk more about thyroid. In fact, I think that would be great because yours isn't the only question. We've gotten a few on the One Thing Hormone Survey, and we haven't gone into that. So we'll talk about that tomorrow in more detail. And Maribel says it's confusing because thyroid and hormone imbalance seem to have similar symptoms. I will pose the question for future discussion. Yes, great question. Do regular pharmacies have bioidenticals or only compounding pharmacies? Typically, regular pharmacies have limited amounts of certain types of biologically identical hormones. So they will have certain estradiol patches, and you never want to take estrogen by mouth. Just so you know, never take it or testosterone by mouth. So Premarin, Pravera, no. Estratest, which is an estrogen and testosterone. It's horse estrogen and testosterone that's given by mouth. You don't ever want that because that can actually harm your liver. When you take it by mouth, it goes through your liver right away. So you don't want that. You only ever want to use estrogen topically, or you could use it in what we call a troche or a sublingual drop or a pellet, but you never want to swallow it. So the regular pharmacy does have certain patches that you can use that are just estradiol. And there is a progesterone cap that's kind of a one size fits all that regular pharmacies have. But the problem is that most women need estriol, the E3 also, especially because it helps prevent breast cancer. And most women don't feel optimized when they don't have a good level of estriol. And the progesterone that's available commercially only has a half-life of 6 hours, and that's not enough, right? You need it. You need progesterone 24 hours a day. So they're not the optimal. So typically a compounding pharmacy can make exactly what you need for your particular situation based on your lab results. So like with the Dutch test, we get back exactly where's your estradiol, estriol, estrone, progesterone, testosterone, right? We get all that. And then you get a customized prescription instead of a one size fits all, which is what mainstream medicine does. You get a customized prescription that has exactly what you need. You get retested and adjusted until your dials are all what I call at 12 noon. So they look like little clocks. And then you want them all at 12 noon. And boy, when they're at 12 noon, you feel so good. You're like, oh my gosh, I didn't know I could feel this good. Yes, you can, and you should. Anya, what's about parasites affecting hormones? Yeah, so one of those main metabolic driving hormones is cortisol, your stress hormone. And I call her Queen Cortisol. She will be taken care of at all costs. And your cortisol, it's your stress hormone. It determines your sleep-wake cycle, your weight, and your immune system function, whether you get sick or not, whether you get cancer or not. It's that important, and you cannot live without it. You can live without sex hormones now. You might not want to because you would feel terrible, but you can survive without them. You cannot survive without cortisol. So your body will save cortisol at all costs. And the problem with things like parasites, which over 60% of Americans have, yes, we just are doing the gut rehab and detox. So the ladies who went through the hormone mastermind now went into the gut rehab and detox. That's why I was talking to them last night. And I'd say about a third of them came back positive for parasites. So it's very common. Actually, over 60% of Americans have them. And the problem with it is that there are these slow lingering infections that are stimulating your immune system constantly 365, 724, 365. Your immune system is having to trying to get rid of these, but it can't get rid of them. That affects your cortisol stress hormone. And your cortisol stress hormone affects all your other hormones, insulin, thyroid, estrogen, progesterone, testosterone. So if you have parasites, it's almost impossible to balance your hormones. You've got to get rid of the parasites. So that's key. And yes, you can take bioidentical hormones every day. So it just depends on, what stage you're in as to how they're prescribed. And they're really kind of 3 different stages. So one is the fertile stage for women who are ovulating and fairly regular, or maybe a little bit irregular with their period. So this might be women in their late 30s, early 40s. So we might, depending on your levels, dose you a certain way. But then when you get past that, maybe in mid to late 40s and you're late perimenopausal, and the periods can become more irregular and the imbalance is more pronounced, then we usually dose you a different way where it's not every day, but you might take it for 3 weeks. And then once you go through menopause, most people take them every day. So I hope that this is helpful. Thank you guys so much for joining me. It's been such a pleasure to be here. Let me see. Jamie says, oh my God, I am still taking PremPro orally while I get the BHRT in my system. Guess I better wean off quickly. Asked my OB/GYN about the oral route causing migraines, and she didn't know this. So this is the problem, Jamie, and I'm going to close with this. This is a great comment that you're making. So PremPro is what they were looking at in the Women's Health Initiative study that caused the increased risk of breast cancer, heart disease, and stroke. So I don't recommend for anyone to take that. You need to, and I don't recommend, it's not recommended for any woman to take these hormones orally because they do cause a problem with your liver. Now, having said that, it's still available on the market. right? So the FDA didn't come say, oh, this is dangerous, take it off the market. Your doctor can still prescribe it. And there are a lot of doctors who, what they learned in residency, whether it's 10, 20, 30, 40 years ago, is what they will always do. And they're not going to change just because of some newfangled information. But what I say is that unfortunately, that might be causing you a lot of harm. And this is why I made that pledge that day that I read that book, that I was going to teach as many women about this as possible, because you go to your doctor thinking that you're getting the most up-to-date, healthful information for yourself, and you trust them, not realizing that that's not always true. But unfortunately, it's not. And what you shared is case in point. So yeah, you might want to find a doctor who's a little more up-to-date with what's available, preferably someone who's trained in bioidentical hormones, like I am. And if it's useful, we do have women who are like, I don't know anyone like that in my area, who have jumped into the mastermind. So let us know if that could be useful. Maribel, I do need to jump off. I see you have another question. If you could go post that in the One Thing Hormone survey, we can possibly answer that tomorrow. I definitely want to tackle talking about thyroid tomorrow, because we got a question today, and that's been a common one on the survey. But I do have to jump off because I have another meeting. But thank you guys for joining me so much. I hope you have a wonderful, wonderful rest of your day. Bye-bye.